am so excited that we are kicking off our Wellness Month. We have a packed house and packed agenda for you this month that I just am really, really grateful for the way that this is all kind of played out. As my friend Amanda Valentine talks about, a lot of times we get moving so quickly in life and we pack our schedules and agendas with things, and it's starting to creep in a little bit, right? Like we're making play dates for TikTok videos, and we're having to run and do things with family. And I think that this period that we've been in, it's just so crucial for us to consider what life could be like if we do just take that time to prioritize ourselves a little bit. And that is what Wellness Month is about, is just in time for us to start getting restless and starting to think about filling our schedules with things that have nothing to do with our own self-wellness, with filling it with things that we need and things that can fill us up and things that can help us be strong for others. And that is why this entire month we have really packed it with the top experts in our city that can speak to a variety of different topics, whether it is from skincare and skin health. We've got Erin, who will be speaking about all things finances and helping us with our financial literacy, knowing that that's going to be really crucial as we are the decision makers, ladies. We have to be in control of our own finances, and unfortunately for so many of us, responsible for the finances of others. And we will be moving into some programming with Loris, as you guys know, my angel coach, our executive coach in residence, who is just going to be able to speak on a variety of different topics, but in this one in particular, focusing on our emotions and how do we really dive in and understanding ourselves and understanding who we are at the root of who we are and who we want to be, and how that's going to catapult us forward into this really uncertain time with a little bit of direction. And I am, just looking forward. We have hand selected these people because they are members and they are a part of this community, and it's people who are committed to their own wellness as well as the wellness of others. And I think that that's the piece that really is the magic of all of this is we all know that we're not perfect and we're all not just trying to bestow wisdom, but this is really a give and take effort and a one big conversation. So that's what the intention of today is all about, is with this kickoff. Dr. Maccarone is, just absolutely become an integral part of the foundation of Wise Wellness Guild. And as we're thinking about, how we're going to grow and expand, we've got members from, coast to coast. We've started to pick up momentum in this virtual world that we previously didn't have because we were kind of bound to the physical space. So that's something that as we expand the network, we will also expand our expertise and who we're bringing in. But, the core of, I've always said this, the core of being able to prioritize ourselves and, really what the model for healthy living actually can live right here in the Midwest, because we really, our values are so rooted in the things that really matter. And that is the part that I'm really not going to be humble about, is that I really do think that we can change the way that women work and live in this country. And so with that being said, just a couple of housekeeping things for the month as we kick off. The first is that if you ordered a wellness box, please let us know, or if you want a wellness box, let us know what you think. I would love to continue to do these as we support local businesses and other companies that are just really trying to grow during this time. We are thinking about doing more dedicated kind of, I want to call them theme boxes. It doesn't really, I need to come up with a better word for that. But thinking about doing boxes that are dedicated to each of the different pillars of wellness. And so if you have any feedback of something you'd like to see, please send me an email. This is all about you guys and how I can deliver for you. If you did not get a wellness box, if you went and it was sold out, we are offering another round through Wednesday. So Wednesday, close of business. We will be closing everything down for the month. But if you want one, go ahead and get that in the next few days. And if you want one for Mother's Day, I can round up a few things. But DM me or email me directly. Don't go online and order it because it'll be rush and I'll have to kind of figure that out. Okay, the second thing is Wellness Month with programming. If you cannot attend everything, that's okay. I understand we have things that come up. We sometimes just need to take these hours for ourselves to go for a run, be outside, sleep. And so I get that. We will be recording these, and actually we are recording this one right now. And this will be available for everybody on the member portal. So if you have somebody that you know who is a member who maybe wasn't able to join today, we will make sure that this is available for everybody. So it's a little bit more pressure for me because we don't usually record these or usually ad lib, but I also don't want you to feel like this should hinder you from being able to ask questions and speak your mind. That's not the intention. The intention is making sure that it's just content available for everybody. So if you do have any challenges with that, please let me know. And I think that the last piece is I really want you guys to just enjoy this time. And if you have any questions after this, that's where this is the guild. Like, we are at your fingertips. We are available for you to ask any questions that you want. And I spoke with Dr. Maccarone earlier, and we're actually, just like we do the Wise Readers book club, we have the DBT group with Maggie Wilhelm, who is a psychotherapist out of California, which is all about acceptance versus change. We have a community circle in that. And then we had 30 Days of Gratitude, which was a community circle led by Rachel DeRochers that just wrapped up last week. We will be doing a community circle actually for skin health with Dr. Maccarone. So if you are interested in joining that, that is available on our website in the member portal. And that is just an opportunity for us to talk as a community about skin health and about skincare, and we can get really girly, and then we kind of like get into the fun stuff, the beauty stuff, but we also are going to talk about the science of things and what that inside out stuff looks like too. So I've said enough. This is not my show. This is Gina's show, and I am just so excited for her to be able to share this with you. So a little bit of background on Dr. Maccarone. She is a general surgeon at the Christ Hospital by day, but she has recently embarked on an endeavor with the Christ Hospital to be the medical director of their med spa, which is opening. And it is just such a testament to her pursuit of an undeniable relentlessness for trying to help people in this community be better and strive to achieve more. And she has brought that full force to Wise Wellness Guild in so many different ways, and just being empowering and supporting as a woman, and also just sharing a lot of really thought-provoking ideas that can really push all of us to support each other a little bit more strongly. And so I'm so honored to have her here today, and cannot wait for you guys to learn more about what all the things that she's doing. She's the Surgeonista on Instagram, so make sure you follow her. But she is a Wise Wellness Guild founding member as well. So thank you so much, Gina, for being here. We really appreciate it. And take it away.
Thank you, Stevie. I will also preface in that this group has just been such a big support system, and all of our programming that we've had over the past couple of months have just been awesome. And there's a little bit of pressure on me. I know there's not a ton of people, but I'm not really great at speaking in public. So I am a little nervous. If you cut me some slack, but I want to also say that this is totally informal. So speak up at any time if you have questions or if something doesn't make sense. but I do kind of have a little presentation prepared, but it's, like I said, really informal. So let me see if I can figure out how to share this. There we go. Okay, can you guys see that?
We sure can.
Okay, good. There we go. And Stevie was so gracious to give me the WISE imaging for me to incorporate as well.
Gorgeous, if I do say so myself.
So basically, we're starting off the Wellness Month with a skincare seminar. And some people might say, well, we're in the middle of coronavirus. Why are we talking about skincare? But there really is a purpose in trying to make sure that we are taking care of ourselves and trying to feel like ourselves when the rest of the world is so different from what we're used to. So that was kind of my initial objective, is to bring to light that, you know, it is okay to take care of ourselves even when, you know, right now things are a little bit crazy. So and then at the end, I'll kind of get into more specifics about skincare details, kind of skincare 101 for people who aren't familiar with the steps and things like that. And then I'll kind of highlight a couple of my favorite products to end, but interrupt me anytime. So I titled the seminar as Be Beautiful in Uncertain Times. See what I did there? And so for Wellness Month, basically, I'm trying to bring to the point that using your skincare ritual can help us alleviate our anxiety when the world seems to be crazy. And finding your center can help you relax and kind of get back to your center. So the point is to basically find things in life right now that you have control over, like your skincare ritual, and using that routine as like a calming effect to try to get some relaxation time. And really, we can use this as an exercise in mindfulness as well. So the good news about this is taking care of your face, emphasizing your skincare routine as a way to relax yourself also helps you look better. So using that time of day in the morning and the evening to just give yourself a little time out where you can, it sounds very silly, but feel your face and feel your skin. Give yourself a massage while you're washing your face, and try to close your eyes and you know, like all of the things we learned in our mindfulness seminar just a couple weeks ago. This is a great opportunity to do that. So a lot of people are, self-care is a word that's thrown around a lot, and a lot of people kind of feel like if I'm doing self-care, that means I'm being selfish. But it's actually not. That's pretty backwards, if you ask me. The concept of self-care is targeted at women mostly, and we're supposed to be reminding ourselves, oh, you need to take care of yourself, but don't forget that you're supposed to be taking care of other people at the same time. And so it just becomes this really strange mind game when it doesn't need to be like that. You know, we don't need to add self-care to our list of things to do as we're running around like crazy, taking care of kids and things like that. So practicing self-care is something that we are can indulge in and take the opportunity for us to feel like Beyonce for a change, and give ourselves a little bit of richness, so to speak. So self-care isn't selfish. it's a discipline because it requires you to prioritize the things that you feel are important. And when you cultivate that, it helps you feel better to be able to take care of other people better. So really having the discipline to take care of yourself is what makes us better in general, so that we can do all of those things for our families, so that we can, you know, run the kids to soccer practice when it comes back and still feel our best while we're doing that and not feel so spread so thinly. So skin is actually the largest organ in the body, in case you didn't know. So you can really consider skincare healthcare because we're taking care of the biggest organ in our body. So the taking care of your skin isn't necessarily vain. It's not solely for beauty. It's actually part of your health. And a lot of people forget that because there's other organs that we're always hearing about. There's other health issues we're always hearing about, COVID, viruses, those kind of things. But skin is actually the organ that shows us what's going on the inside because it's in your face, literally. And when you're stressed or not eating well, that shows up on our skin. So trying to remember that skincare isn't just vanity and beauty, it's taking care of your body, basically. So I'm going to do a little bit of science. This Dr. Obagi, which we'll get into my love for him a little bit later. But like he says, the skin isn't a thing to decorate. It's an organ that you need to nurture and heal. And everyone needs to do certain things to optimize your skin type. And so a little bit of science. The skin has 3 layers. The top one is the epidermis, and that basically forms a seal for keeping anything that's harmful out. The next layer is the dermis, which is actually the strongest part of the skin where all of the hair follicles and blood vessels come through. So that's where all of the nutrients come from the bloodstream in the body. And then there's the subcutaneous layer, which if we're talking about applying products, we're not able to reach that. All of the things that are topical that we're going to talk about are affecting the top 2 layers. So hopefully we're not all confused yet, but I'm going to kind of go through the basics, and I apologize if everyone already knows this, but I've found that a lot of people don't know the basic steps that you should be taking twice a day to take care of your skin and try to keep it healthy. The first one, obviously, is washing your face. We should wash our faces when we get up, and we should wash our faces when we go to bed. It's the way to remove oil, impurities, bacteria, all those things, and it allows us to have a clean slate for the rest of our routine. And the next one that people often forget about is exfoliating. It's super important because our skin always has a top layer of dead cells on it at all times. So if you're trying to have your skin glow as well as possible, you need to be removing that top layer and revealing the glow underneath. And so a lot of times there's so many ways to exfoliate. There's chemical and there's mechanical exfoliators. And depending on your skin type, that can be incorporated every day, or that can be just a couple of times a week if you're a little more sensitive. The next one is toning. Toning is often overlooked because it restores the proper pH or the proper acidity to your skin so that you can prepare it to be treated with the next steps that you're taking. So you're probably thinking, okay, we're already 3 steps in. How many more are there going to be? I don't have time for this. But the first 2 steps can often be combined, the cleansing and exfoliating. And then the toning is just a really quick swipe with any kind of toner, like I said, depending on your skin type. And we'll kind of go over that a little bit. And I'll touch on that at the end if everybody had seen the skincare quiz that was sent out prior to. Now we have a surface for which we can treat the skin that's optimized. So everybody has different concerns: acne, dark spots, hyperpigmentation, fine lines, wrinkles, redness. There's so many different things that we can treat. And these can be serums, creams, gels, lotions, all kinds of different options that we have. I'll get into the basics of how to apply them, or what the proper layering technique is in a little bit. But after we've done the treating and repairing of the skin concerns that we have, the next thing is sunscreen. And now it's becoming a little bit better in that most products that you see on the shelf have some kind of sunscreen in them, because we've figured out how important sunscreen is. You get sun exposure, you get UV exposure anytime you're outside, in the winter, the summer, and even when it's cloudy, you're still getting free radicals that are being released into this by the skin that can cause damage. So having an SPF is super important. I will say, once you reach an SPF of 30, having a higher SPF has very little benefit, because SPF of 30 filters out 97% of ultraviolet rays. If you get SPF 50, that filters out 98% of the sun's ultraviolet rays. So some people think, oh my gosh, I need to have SPF 150. It really, after you get past 30, it doesn't really make that big of a difference. So, but this is probably the most important step in your skincare routine, aside from cleansing. And I'll kind of give anybody have any questions so far?
Sorry, can you hear me? Hey, you there?
Yeah, can you hear me?
Yeah, sorry, I think in trying to unmute myself, I muted you. Question on, yeah, sorry. Question on moisturizing, which I'm hoping you'll get to. I'm very particular of what I put on my face, but what I put on the rest of my body, I'm like, whatever, like hand lotion on the legs, you know, but as you think about aging, I'm starting to think more about, as I'm older, like more about that. And I have started to pay more attention to some of the things that I get, in particular, like if I get in gift baskets or something, like I'll get things that are probably full of a bunch of stuff that isn't super helpful. Or I would love to at some point just touch on, like, what are the key top 3 ingredients I should be looking for maybe in a moisturizer that I know that it'll be efficacious.
Yes, great question. I will touch on that a little bit.
Great.
The skincare industry is now starting to have the same realization that you have, that we do all of this on our face, like what about the rest of our body? So it's actually an up and coming, there's more and more products now that are being targeted to having active ingredients to treat the skin on your body, because like you said, why not? And that kind of goes back to the same thing we just went over, is, you know, cleansing, exfoliating, toning your whole body is not really that economical, but exfoliating is a big one. And applying sunscreen everywhere is a big one, particularly places that are exposed, like your hands or your legs if it's summertime. So yeah, we'll touch on that a little bit, and then I'll also get into some of those ingredients that we were talking about.
Awesome.
So I get a lot of people who ask me, what is the difference between medical grade skincare and regular skincare, like that you could buy at CVS or Sephora, and there is a difference. It's just a little kind of chart. So basically, things that you can get at the drugstore, Walgreens, CVS, Meijer, the active ingredients are actually in pretty low concentrations because they're trying to be cost effective. So a lot of these types of products will have a lot of filler or fragrancing that they're not necessarily spending money on the right things. They're just trying to get someone to buy that product. So their packaging is always a little more pretty, or their marketing is very big, but really the substance of the products at the drugstore, not to say that they're not still good and they can't be effective, they're just not as effective as medical grade. So the next kind of step would be the things you can buy at Nordstrom, Sephora, Ulta, those kind of things. They're slightly better, as you see in the pricing. They're slightly more expensive. So they may have more active ingredients, but they still often contain fragrances, other chemicals, and they're still made in really large quantities for a generic audience. So again, all of this kind of leads to those being a little bit less effective. So we get to my favorite, medical grade skincare is usually sold by a physician or a healthcare provider, and the duty of the person selling that skincare is to help you figure out exactly what's good for you, as opposed to going to the drugstore and making your own self-diagnosis and saying, oh, I think I need this, I think I need that. And you might pick up two things that you're throwing on your face, and they cancel each other out and don't do any good. So that's the advantage of having medical grade skincare, is someone is supposed to help tailor that to your specific needs. And also the products themselves, albeit they are more expensive, are made in smaller batches so that they have a higher level of active ingredients. And you actually don't need to use as much because it's so powerful. So, and then obviously the safety of the ingredients is verified because they are pure, and actually they are also FDA regulated, whereas other products that you buy in the store that aren't medical grade are not at all necessarily FDA regulated. So you don't even know whether the product that's listed on the package is actually inside, which is kind of scary. So these are the most frequently prescribed products that you can get at CVS or Walgreens that dermatologists recommend. So if your price point is, economical, these are the good brands, and I can share this with Stevie. These are the ones, and most of us have heard of all of these. Those are the ones to look for. On to the brands that you see at Sephora. These are also brands that are kind of tried and true and been around for a long time. Most of them have been developed by a physician or dermatologist. Murad, Dr. Dennis Gross, Ole Henriksen, those are all developed by physicians, but again, they're still being marketed and mass produced such that the active ingredients may not be as effective. So we get to the joke is, people often tell me, like, oh my gosh, there's no way that I can buy a medical grade product, as they're spending their money on Starbucks every day. So if you decide to make it important to you, it's worth the investment. And like I said, a lot of times, because the products are so much better, you're not having to use as much, and you're not having to buy them as frequently. My favorite brand, and this is the one that I carry in my practice, is Zio by Zain Obagi. Funny story, Zain Obagi used to be married, and they had a product line called Obagi Skincare. When Dr. Obagi and his wife had a falling out, they got divorced, and his wife got to keep Obagi Skincare, And so he developed his own line, which is called ZO, which to me, I've had experience with many, many, many products and have a huge skincare graveyard. These are the best that I've ever used. And I really, if anyone got a wellness box, you will have a travel size of the exfoliating paste, which is just so heavenly, as Stevie raves about on Instagram all the time because it's just so awesome.
So I was previously using an exfoliator and then had kind of started using like exfoliating pads. And this is the first one that I've gone back to. I like grew up on St. Ives, right? Like the big shells just taking bits out of your face, and like it's like every dermatologist's nightmare. This is the first one that I've really liked, that I can like actively see a difference when I don't use it after a couple of days.
Yeah.
Because you just start to see like I don't know, it just evens everything out. And I mentioned this on the Instagram. Like I had a few scarring spots that I've been working on for years with chemical peels to get rid of. And within this, what are we on? Today's day 21. It's honestly, I'm not even using makeup on it anymore. Yeah. It's like crazy. And so it's incredible. Chelsea said I used it last night and I felt like I looked 13 this morning. It's so the hype is real. And I do not just give away compliments. Like I know I'm a like very optimistic person, but yeah, it's awesome.
Yeah.
Yeah.
So the key thing, and we'll get into a couple more the products later. Actually, I'll just save that for the end because I'm going to highlight my favorite ZO products that I like. So because there are so many different skin concerns and skin types, I would not have enough time in the world to go over everything like acne and rosacea and those kind of things. But most of us here, or most women in our age group, are concerned about anti-aging. So I kind of picked the most popular and the most effective ingredients for anti-aging to highlight here for all of us. And if anyone follows my Instagram, you may have seen some of the same information. The all-time multitasker magic ingredients that everyone raves about is retinol. And retinol, it comes in many different forms. There, you'll hear about retin A, which is the prescription strength. You'll hear about retinoids. You'll hear about retinoic acid. They're all basically the same variation of the one ingredient. And the main purpose of retinol is to, it kind of is a chemical exfoliator and to encourage the skin to renew itself. So it's working on the dermis, which is the second layer of the skin, because that's where the new skin cells are reproduced, and that's where they come through. So retinol, the good news about it is, even though I said I wasn't going to talk about acne and those other issues, it can be good for a multitude of different skin issues. And how does retinol work? Basically, it firms the skin, it improves your fine lines, it helps your texture, it helps make your skin tone more uniform. And the only side effects, which tend to subside as you have used retinol for a little bit longer, sometimes it can give you a little bit of redness and it can cause some flakiness. So I was actually touting at-home skin peels with retinol products, because this is kind of the perfect time to experiment with these things. You're not really going anywhere. The only people you see are your family, and they love you anyway. So why not do a chemical peel and get through that before we all have to go back out and see people again? Or if you have a Zoom meeting, you can just say you're not going to share your video for that couple of days. But
and Gina, anyway. There's a question from the group. Can you touch on retinol and pregnancy? There are mixed reviews about what grade is okay to use.
Yeah, so there's the problem with that is no one has really wanted to do a study because it's hard to find pregnant women who will say, yes, I'll take the extra strength while I'm pregnant and we'll see if anything bad happens. So that's why the data is not that reliable, and you hear so many different things. Typically, if you're applying something topically, and this is my own medical opinion, which take it for what it's worth, things that stay within the top 2 layers of your skin are not going to be absorbed systemically. So Botox, if done properly, and topical skincare really, in my opinion, are safe, because the probability or the chances of them being absorbed by the bloodstream, because they can't penetrate that far. So it's really, to me, it's very low risk. Everyone has different comfort levels with that, but that's my own personal take on that.
Great.
Any other questions so far? No? Okay. So how do we figure out which retinol to use? This is kind of one of the things that goes back to how products are packaged and how they're presented to you. So a drugstore retinol can be sold in any kind of packaging because they're just trying to get money for their product. They don't necessarily care whether the product works for you after it comes out of the tube. So retinol and its derivatives is kind of an unstable ingredient. So it has to be delivered properly from a chemical standpoint, and it has to be packaged properly because it shouldn't be exposed to sunlight, because that makes it less effective. And there's other ingredients that we'll talk about that some of them can't be exposed to air without being rendered ineffective. So yet another reason to consider medical grade skincare. But there are good over-the-counter retinol products, and I'm happy to do skincare consults with anybody who wants to learn about those. I thought it would be too much to include all of that in this. So the next ingredient that is really important is vitamin C. Vitamin C, from a science standpoint, is the component that helps our collagen reproduce and our collagen to remain stable. Collagen is the structure within the skin layers that gives us strength and firmness and kind of that plumpness. And vitamin C helps collagen rebuild itself. So if you have an injury or a scar, vitamin C helps that collagen heal and provide stability to the skin layers. And that is actually the ingredient I was talking about, where if it's exposed to light or air, it's completely ineffective. So if it's not in an opaque package, or if it has a screw top that allows the whole thing to be exposed to air, that's not going to work for you. So typically you want to see an opaque package with a pump, where the only product you're getting is the one that you're putting directly on your face. Glycolic acid is one of those chemical exfoliators, and it is another product that helps our collagen to build and keep our skin tone more even. This comes in many different strengths. Some of them can actually be up to the level of chemical peels. Those would obviously be prescription or medical grade, or treatments that are done in the office. But this is a really good product for smoothing the skin and making it more even. Skin lighteners. A lot of times as we go through life, we get areas of sun damage or hyperpigmentation. A lot of people, even in pregnancy, can get melasma or just really severe uneven skin tone. For those particular people, there's a product called HYDROQUINONE, which is prescription only, that is a skin lightener that works very, very well, but it has to be a specific protocol. That's why it's prescription only. And then the over-the-counters are called kojic acid and azelaic acid. Those help to lighten up those spots of hyperpigmentation and, again, give us a more even skin tone. So everyone gets caught up in, which do I put on first? Which thing do I layer over this? The main principle is putting on the thinnest or the lightest products first. So after you've cleansed, after you've exfoliated and toned, you want to use your serums next. So those are typically the most lightweight and clear. Those would go on first because those are absorbed very quickly. And then you build from there. So the serums and then your moisturizers or heavier products come after. This is another scenario where having the guidance to know what order to use the products helps them be effective, because if you're putting on your sunscreen before your serum's completely worthless. So having a little bit of knowledge is a huge help. Well, there's just a pretty layer cake as far as layering your skincare products. On to a couple of my faves. This one is called Growth Factor Serum, made by Zio. And it basically is not a retinol product, it's a gel, and it's very heavy, but it's very potent as well. And it also feels so good to put it on. It basically does those same things, helps build our collagen, helps firm up the skin and make it more resistant to movement. It's, of course, not as potent as Botox, but it has ingredients that penetrate the skin to try to help the skin integrity from the inside. And it has this great little pump where you just push on it and the perfect amount comes up and you just spread it on. And that's always the last step, because this is actually a pretty heavy product. The exfoliating polish is probably my second favorite Zio product. And a lot of the exfoliators that you see, Stevie mentioned St. Ives, which I used to use when I was a teenager as well. If you don't have granules that are smooth, they can cause micro tears in your skin layer. So salt or sugar or these other really harsh exfoliators that you can buy over the counter are basically just tearing up your top skin layer and causing actual damage, as opposed to gently removing the top layers that we're trying to get rid of. So this exfoliating polish is just amazing, and it feels and smells so good. It's awesome. And then the last Zio product, which is a little bit blurry, but it's the vitamin C. It's a 10% active, and like I said, when it comes out of the pump, it's straight to your hand to go on your face so that the integrity of the product is maintained. And it has kind of a blurring effect, and it feels like silk when it goes on. It makes your face feel very smooth, and like I said, it kind of provides a matte blurring effect to help hide any imperfections.
I was going to ask you that. Yeah, it's amazing because I use that benefit like perfection usually.
Yeah.
And I feel like I don't even need to use it by using that. Like it kind of blurs. Is that like a silicone in it, or do you know what that?
It does have a silicone base to help it go on uniformly, and it has that mattifying ingredient as well. But it's not drying, which is nice because we don't want to take moisture away from the skin. Is anyone very lost?
We do have one question, just in regards to going back to, you said the layering. Yeah. Is it fair to say that sunscreen is the very last thing that you put on, or yeah?
Yeah, sunscreen's always last.
Okay.
Because the sunscreen itself is heavy, and if you put on other, just the same way as say you put on SPF 30 and then you layer over top of that later with SPF 15, the top is always going to be what is giving you the effect. So if you put your sunscreen on before your vitamin C, then it's making the sunscreen less effective because it wasn't the last layer.
And then there's one more question. This comes from Tori. Oh, I'm going to totally botch this. The hydroquinone.
Yes.
Did I say that right?
You did.
Oh, how about that? Would you suggest this as a first step to treat melasma, or do you really need a peel heavier treatment to make it go away?
Actually, it's depending on how quickly you want to get results. A peel is going to get you results faster. Hydroquinone is a protocol that you follow for 3 or 4 months. So it's a little bit slower, but it is very effective. It works very, very well. So it just kind of depends on what your goals are. Typically, when I see patients who have melasma or hyperpigmentation, I put them on the hydroquinone protocol and then see where they are at the end of their 3 months, because you can't use it indefinitely. It has to be on a timeline, otherwise your skin builds up a resistance. So after their 3 months on the hydroquinone, then I'll say, do you still have areas that you're worried about? And then we talk about doing peels or lasers to help with that. What else? I don't know how to see the questions. I also put the quiz for everyone to look at again. I wanted to offer to everyone, if you want to fill out your quiz, Stevie, maybe you can help me figure out how they can submit that to me. I'd be happy to do this for everyone who's attended. So if you want to have that information communicated to me, I can get back to you with a regimen from the drugstore. I can get back to you with a regimen from Sephora or Zeo, depending on your price point. So I wanted to throw that out there for everybody.
Yeah, I think that's great. What we can do is, if you guys fill this out, you can either I can aggregate all of them and like make that connection, or your information's right down there too. So I think you can feel free. That's the great part about Gina, is like, she's super responsive. And I realized I will follow up with the updated link to where to make an appointment, because I didn't update that. But that will be back online here sometime too. But I think that's the piece that, just going back to, I've been very grateful in terms of how just even the most minor of questions, like, you've been very responsive on like how things are going and all of that, or if you have a question. But I think that we can probably, by having this affinity group and kind of having this community group too, answer a lot of each other's questions too, which again, you've given us permission to say the skin is our largest organ. So let's start thinking about it less as this frivolous investment and more in actually how it's a reflection of who we are in our wellness. So
yes, exactly.
Great.
And
Awesome.
I do want to say that, unfortunately, the med spa is not seeing patients actively. So if you want a consult with me, just contact me directly. Hopefully soon we'll be back in business and seeing patients and delivering the Botox and everything else that everyone needs. But for now, if you have anything that you need, please just contact me directly. And I have this level of OCD such that I have to respond to people, or I can't function and do other things. So that works out well for everybody.
I think that there are a few other questions. I don't know if I can hop in and ask. Ashley asks, what do you recommend to use for eye makeup? Her exfoliating cleanser isn't quite cutting it.
As far as eye makeup or eye treatments?
Ooh, Ashley, do you want to come off mute?
Can you hear me?
Yep.
Yeah, so I've been using the Zoe products for about 4 months now. Mm-hmm. And I also have complex renewal pads, which I do not use on my eyes.
Yep.
But I don't use, well, I haven't really been putting on makeup, so it doesn't usually, it hasn't really been an issue for the last 2 months or so. But when I do put on makeup, in particular mascara, I just find it really challenging to get all of the mascara off. So I always have to, get cotton swabs or something to kind of get that off. And I just can't quite eliminate all of the eye makeup, even after using the cleanser. So I'm just trying to figure out if there's another product I just need or what I should be doing.
Typically what I do at the end of the day, and I'm in the same boat as you are, today was the first day I put on makeup in a very long time because I'm doing a skincare seminar. But whenever I have makeup on at the end of the day before I do my nightly routine, I actually use makeup remover wipes first and kind of gently try to get my eye makeup off and loosen it up as much as possible. And then go through the cleanser. And then as far as eye makeup remover, Maybelline makes an eye makeup remover that's like $3 at Walgreens that is really good, and it's better than these other, which is the one instance where I feel like a drugstore product is sometimes better than the kind you find in Nordstrom. But that tends to work really well. But it's a struggle, especially if you're worried about your mascara transferring. You buy mascara that stays on because that's what you need, but then it's hard to take off at the end of the night. So the other thing that you can do if you're really still having a hard time is use a waterproof eye makeup remover. Those tend to be a little bit stronger too. What else? Did I miss that? Oh, here's the chat. Now I can see.
There we go, at the bottom.
No worries.
And then there's one from Jenna, which is the growth factor serum okay for acne prone skin?
Yes, it's non-comedogenic, so it doesn't clog pores, and it doesn't really contain anything moisturizing, so it doesn't contribute to oiliness or anything like that.
Okay.
Yeah.
And I had a question just in regards to what I think I know the answer to, internal health versus the way it manifests on the outside. So I know that diet has a ton to do with it, but specifically hydration is something that I'm sure that you get a lot of questions on. So if you are dehydrated, can you just share a little bit about how that might manifest? Because I think that when I'll just share an example, like this, this week I looked in the mirror and I was like, oh my gosh, like I'm backtracking, I'm getting more wrinkles, like I've got these fine lines, I can see more of my pores, and of course I'm this close to the mirror. But I think I backtracked it and kind of said, oh, I haven't really drank a lot of water in the last, 12 hours or so. So can you give us a little bit of insight on what might we do before running to order product right away? Like what are some things we might do inside first before we start to do that journey?
Yes. Staying hydrated is one of the most important things, and that's not just for your skin, that's for any of your organs, because the body, down to even the cellular level, is 2/3 composed of water. So 2/3 of the volume or the plumpness of your skin cells is from water. So if you don't have enough water, your skin cells are shrunken and obviously won't appear as smooth or as plump. So water is huge, and everyone always talks about this 8 glasses of water a day. That's a lot. If you can do that, great. But if you don't have time to go to the bathroom 8 different times throughout the day, then really at least 4 8-ounce glasses of water or 32 ounces of water is is what you need per day. And a lot of us get busy and we forget. So keeping water with you at all times is really important. The other component that a lot of patients have talked to me about during this particular time with social distancing is that they're more stressed and they're worried about their health and they're worried about their family members and their parents. Stress causes you to have hormones that release that crave carbs. And then it perpetuates itself. So the more carbohydrates you eat, and that's why as a teenager, like, oh, don't eat that chocolate, it's gonna make you zitty. It's partially true in that continuing the cycle of carbohydrates causes more of that release of stress hormone, which is what causes that those deep, like, cystic hormonal blemishes. So carbs are okay. I'm not going to be a carb Nazi, but minimizing or including, the vegetables, the fruits, the proteins is important in the diet, is to avoid primarily consuming carbs.
That's awesome.
And then I think
There was, I can answer the one from Ellen really quick, that Zeo is cruelty-free. They are ethical, and no animal testing is, and I just looked this up, I know Gina knows this, but I got really excited because I didn't know the answer to that. That they're either bioengineered or plant-based, which is cool.
Yeah. And the other line that I carry is Jane Iredale, which I'm wearing Jane Iredale foundation and blush today, which they're actually very lightweight. Same story. No animal testing, no toxins. They're environmentally friendly, which all of those things are really important, obviously.
That's great.
And then I think Nori says, oh, actually, Chelsea's asking, when do we get Botox? That is a personal preference. Some people are anti-Botox, which is totally fine. Like, I don't want to inject poison in my face, but that's actually not what it is. It's just a chemical ingredient that comes from bacteria. So it's not poison. That ingredient happens to paralyze the facial muscles. So a lot of people are now having Botox in their late 20s and 30s is kind of a preventative measure, because with repeated contractions of certain muscles, particularly your frown lines, it starts to form those fine lines within the skin. So it's, like I said, it's not systemically absorbed, so it's perfectly safe, and it can be preventative if you start early. But also, if you already have fine lines and wrinkles, it helps relax those and helps make them less noticeable in combination with your skincare routine. So as far as when do you start doing it? Now, whenever you want. If you're starting to see those lines, that's kind of when most people would say it's a good time to start. Let's see. Oh yeah, Nori was asking about dark circles and under eye issues. That is kind of the same. The skin underneath the eyes is much thinner and very delicate. That's why things show if we're dehydrated and we get those under eye circles when we're tired, is the skin is so thin here that the blood vessels underneath the skin cause those dark circles. So if you can thicken the skin with retinol, causing it to reproduce, typically retinol under eye products, they're formulated differently than your normal retinol skincare because the area is more delicate. But that's what helps to conceal the dark circles so that you're not seeing those blood vessels, and thicken the skin so that the puffiness or the bags are not as noticeable as well. Let's see. The personal microdermabrasion, it's the ones that they sell at Sephora. I mean, they work. I personally like to use it as an excuse to go have a treatment. But if you'd like to do it yourself, it works perfectly well, and it, same thing, removes that top layer of dead skin cells to help reveal the better skin underneath. And that kind of goes along the same lines with someone asking about dermaplane. Can you do this yourself? Definitely. The difference between the little razors, okay, so a man's shaving razor and those little razors you can buy at Sephora, those are not quite as sharp as the medical grade scalpels. I wouldn't recommend normal lay people using medical grade scalpels on their face. But those other regular razors and those little ones you buy at Sephora, they certainly do work and they give you the same effect. It's just never going to be as significant as having the medical treatment, which unfortunately I do it to myself all the time. I use the little scalpels, go through and do it on my own, especially now. So, but we do that in my office too. My nurse is really good at it. Anybody else? I hope this was helpful. I know everybody has heard a lot about skincare, but it's such a wide topic that I'm glad Stevie started the interest group so that we can have ongoing questions and things like that.
I think that some of the questions that I have are, I'm really excited to get into them for specific needs too for people, because I think everybody's going to have a little bit of a different goal. And I think it would be awesome for us to do one that is about, I know I've received questions from people in the past that have been, oh, you know, I've started working out more now that I've been home. But now, like, I'm starting to see more, you know, acne on my back or something like that. And so that was part of the question, you know, people asking that. And then also you and I talked about the cellulite, like these tools that you see. I'm getting bombarded with stuff on Instagram, and like you, I have such a graveyard. Jenna probably does too, from working at P&G and beauty. We just like try everything too, but it's so bad because a lot of it's gimmick. So I think that those are two things that I would love for you to just touch on high level, and then when we do the community circle, we can kind of dig into more of like how to manage that stuff.
Sure. So a brief comment on exercising. If you're doing light exercise where you're not really working up a sweat, that's not as big of a deal. But for people who do really intense like interval training or Orange Theory or really intense workouts where you're just sweating, ideally, I always keep makeup remover wipes in my purse so that I take my makeup off before I work out, and then I do another one immediately after if I'm not able to like get to the shower to wash my face right away. So the problem is that when you work out with makeup on, it provides a layer to trap the bacteria that are coming out from your pores while you're sweating. So it can definitely contribute to any acne issues or blemishes. So ideally, if you can have something to cleanse your face, to remove your makeup right before you work out, and if you're not going to shower immediately, doing another makeup remover wipe afterwards can help with that. And as far as cellulite goes, the really unfortunate thing is that it's just one of the toughest issues to deal with. It comes from the connective tissue between our fat cells that can tether the skin in certain areas, and that's what causes the dimpling. Unless you surgically release those connective tissues, you can't get rid of cellulite. There are products that are topical that can help plump the skin. The ones that work best have caffeine in them because it stimulates blood flow within the skin layer. Those can help conceal cellulite a little bit better. ZO actually makes a product that works very well if you use it twice a day, which is sometimes hard to do. So, but if unfortunately, if you have really deep kind of dimpling, that's something that's not going to be improved without surgery, which is a bummer. And then I think Tori had asked whether we have take insurance in my office. We don't, unfortunately, for the med spa purposes. I do take insurance for any of my other surgical procedures, but to simplify things, it is cash only. But we are priced very competitively compared to particularly plastic surgery groups, which I will say, a lot of people think that getting their Botox or other kind of less invasive cosmetic treatments, they say, oh my gosh, I need to go to a plastic surgeon to have this done. Plastic surgeons are great, but their primary job is to do operations. So you may say, oh, I'm going to go have a plastic surgeon do my Botox. They may not be the best at Botox because they don't really focus on that or care about it because they don't make most of their money from Botox. They make their money from doing facelifts and other really more invasive procedures. So people like me, and there's even RNs and nurse practitioners who are phenomenal at injectables and Botox because that's what they do all the time. So the funny thing is plastic surgeons charge more for Botox, and often that's to deter people from coming in for that because they'd rather spend their time getting somebody who wants an operation. Let's see, somebody asked another question. SPF, blue light glasses for screens. Ah, yay. So the question is about the blue light that we all hear about from screens, from our phones. That is a real thing. And the glasses do make a difference. They certainly help with eye fatigue and block the harmful blue light that comes from all of our technology. And that also goes for your skin. All of the SPF products made by ZO are guaranteed to block the blue light as well. So not many other product lines advertise that, but ZO specifically has formulated their SPFs to block the normal UV rays, but also blue light as well.
Will you be offering like with aging and like veins on our skin, on our legs? Like what kind of solutions, like surgical and not surgical, exist for that?
So for people who have veins that are so prominent that they are almost bulging from the skin or very, very large, those are usually not going to be improved without surgery. If you have kind of moderate vein changes, a lot of those can be managed with what's called sclerotherapy, or small injections that basically scar the vein to eliminate it. However, for people who either have a hereditary problem with their veins in their legs or have been standing at their jobs for 40 years, their surgery oftentimes becomes the only thing that's going to cause permanent solution. We do offer laser treatments for, they're called spider veins or telangiectasias. So those little tiny vein lines that are kind of purpley or look like a star shape, those are perfect for a laser treatment, which is not painful. It's just a little quick zap and then they're gone. The issue is when you continue to put pressure on your legs, you'll get new ones eventually.
So with that that kind of takes me to another, I've been curious. I just got a standing desk because I'm not used to sitting this long. I'm on a roll, and it's so interesting because where I'm at, you can see it from the street, and it is not beautiful, but it's necessary for me because of my hips, and yeah. So we'll just deal with it. But I have been thinking about getting like one of those like ergo comfort standing things to make it a little bit better. I don't know if there's, I've been thinking a lot about the difference between like getting up and moving. Obviously movement is important, but it's really about just moderation in that regard for like all of these things, right? Yeah.
Yeah. Gravity works, unfortunately.
Yeah.
So anytime any part of your body is exposed to gravity for an extended period of time, you're going to see some effects of that. flexing the leg muscles helps clear the blood from the veins in the legs. So even if you're just kind of sitting or standing and you can flex your calves, that helps keep the blood moving up so that it's not putting so much pressure on those veins. I love my old lady compression stockings that I wear to work. They just make your legs feel so much better. And I've even done an experiment where I've had one on one leg and left one off the other, and it makes a huge difference with swelling. So compression stockings, and there's basic ones you can buy on Amazon, but you can also buy the higher pressure. They work even better, although they can be annoying to put on because they're tight. So.
That's great. I never would have gone there, but I'm getting a second the compression stockings from Ellen. So I'm gonna maybe give them a go when I'm wearing pants, because who cares? I guess when you're wearing pants and then you're ready for.
Right. They make cute ones too. Like you can find all kinds of like fun prints and things like that. And you want to look for some that you'll see the pressure listed. You want at least 20 to 30 range in millimeters of mercury. Those are the ones that are most effective.
Okay. That's great, because I do know that veins, not only just from a visual piece, but that they can become really painful for people. Like it can be pretty, I mean, and it's obviously, is it a signifier of health too, or is it just like hereditary? I'm so curious on that.
A lot of it is hereditary. So, you know, having leg veins that can go along with people who have health issues like diabetes and things like that. But just the presence of leg veins is not necessarily a detriment to your health.
Okay. I love this question from Chelsea, but I'm gonna jump in and second the question just more broadly. A beauty counter, a lot of these, a lot of the brands that come, what would you say, like direct to consumer? Is that the right term? Would love to hear your thoughts. I know that you are a fan of Roden & Field, but on beauty counter too, like what is generally speaking?
Everything is different, and many of those products like Rodan & Fields have been developed by dermatologists, so they are good, and you're getting good products that are more affordable because those companies aren't paying for advertising, because the consultants are selling directly to their customers and they do all the advertising for themselves. So Rodan & Fields is actually, a lot of dermatologists sell Rodan & Fields in their offices because that's a particular price point for people, and it's a very simplified regimen, like steps 1, 2, 3, 4, and then you know you're doing it right. The others, it's all kind of, none of it is quote unquote FDA regulated. So there's really no way to know unless, what I like to see is a physician or a healthcare person who's involved, who can give you some kind of reliability, because there's other companies that are just releasing products and they could be putting tea tree oil in a bottle and just saying, here, this is retinol. So you just kind of have to be careful, but typically the ones that are created by physicians are reliable. I also love Rodan & Fields Lash Boost, which is the main reason why I continue with them, because people talk about Latisse or these lash growth. This one works the best. The Lash Boost is awesome.
Okay, any other questions for Dr. Gina while we've got her here? Okay. All right, well.
Sorry, Stevie, I'm jumping in. Hi. Sorry, this is Emily. I'm on my mom's account because she's a member too, and she's doesn't want to be on video. But she's the 40-year RN who totally recommends compression stockings, you guys. She loves her. She's obsessed with them. She said, write that in there. Yeah. But my question, Dr. Gina, is will we be able to, if we decide like we want something or if we want Zoe, will we be able to meet directly with you? How does Zoe work? Like, is it kind of, so I am personally not a big fan of like the MLM setup. I know you love Roden and Fields.
Yeah.
I think their products are wonderful, but I wasn't willing to join to, I have a family member who's a representative for them, but I wasn't willing to hop on the bandwagon because I just don't like the setup of having to spend a certain amount every month. And how does Zoe work?
Zio is just like regular retail. Like my office is a store. You come in, you want this, you want this. We sell kits that most people, that's kind of what they start with, is we have different kits or regimens for different skin issues. And specifically now, what I'm just doing is I'm consulting with people directly, giving out my phone number or doing things through Instagram to do a virtual consult, and then figuring out a way to get a retail product to you that we come up with together. So I've just been doing kind of my own house deliveries so that people don't have to come in to buy it. But for right now, I'm seeing patients with my other medical practice, but because I can't see people in person, the virtual thing is what we're doing for now. Sure.
Awesome. Anybody else? Any other questions?
How do you know how much growth factor you have left? Good question. You can actually take the top off to reveal what's in the rest of the container, because it's created, the growth factor, because it's a pump, the bottom of the product container comes up to the top, and then when it reaches the top of the pump, that's when it's empty. So you can take, there's the cap that's normal, but you can also kind of unscrew the other part of it to see how much you have left. Usually I use mine every night, and it lasts probably anywhere from 2 to 4 months. Oh, there she goes. She got it. Cool.
Awesome.
Okay. Well, I hope this was fun for you guys. I'm always here for you for anything. Just DM, or Stevie can give out my phone number. I'm happy to help, especially guild members. I love talking to them. So fun.
Awesome. Well, thank you so much for leading this today. This is amazing. And like I said, I'm a big nerd when it comes to the data and the science behind it, because it really reinforces the piece of, this isn't just like, this is a science of how we approach this. And it's not just about looking younger, but actually about really being mindful, investing in ourselves, taking care of ourselves. And it's one very visible way to do it. And so thank you. We will, as a part of this, send out the link to be able to join the community group. What we'll do is we'll just have everybody sign up for it, and then we will start to talk about what a cadence looks like that makes sense for us to connect. For the book club, we're meeting once a month. DBT is once a week on Facebook. So this is one where, it could be, once a month too, to start out. And if we want to do even smaller groups that, even within that, I think could be really interesting. So yeah, this is great. So a couple of things. I wanted to take this opportunity. So the person who actually, what I do with all of these winners is I put them into like this random generator, and it kind of spits out the winner. And so the winner, actually, I don't believe she's on here, but Kavina. There's a Kavina Lala is her name, who won the Zio kit. And so I will reach out to her. Hopefully she'll join the WISE group or start to join some of these. But we will have continued kind of giveaways through the course of this month. This one in particular, thank you so much, Dr. Maccarone, for providing that and providing the samples in all of our different kits. As we think about the affinity group too, within that community circle, maybe there's, a little, maybe, we can think about different things like getting rid of your makeup graveyard or your cosmetics graveyard and kind of go through and do that, but also maybe filling it with some goodies and products that maybe we'll have a few extra coming out of this week, and maybe we can use that as a perk if you join. So more to come there. And then I think the last piece is just I wanted to make sure that you guys knew what was coming up too. So we've got Erin, we've got Erin's going to be leading the next event on Monday afternoon. And yeah, I know.
She's excited.
And so make sure that if you aren't signed up for that event, make sure that you go ahead and just click accept. All of you guys should have received invitations for that. So we're really, really excited. It's so important for us. And coming out of that, we'll be able to have additional programming that Erin's going to help us with specific needs. Okay.
And as you can tell, it's crazy here. It's normal. So yeah, my presentation will be very down to earth, very similar. So
I love that. No, that's so wonderful. And I think Erin may have been the first person out of everybody to reach out to me as soon as the Business Courier article went up. She said, we need to meet. And that was, I think last July or something like that.
Yeah.
So yeah, it was a long time ago. So very excited to finally have the opportunity to get this going with Erin.
I'm thrilled. It'll be a lot of fun.
It's going to be great. Like I said, if you were to financial literacy is my biggest area of opportunity. So I'm always excited to find ways to make this helpful. And then the very last thing is just please get outside today. It's so beautiful, and obviously stay safe, socially distance, but use this as a great opportunity and jumping off point for you to just continue to enjoy this day and investment in yourself. And looking forward to seeing you guys on Monday. Okay? Great. Thank you so much.
Thank you.
Hi, everybody.
Thank you.
You're welcome.
Thank you. Thank you.
Thanks,
You're
Laura.
welcome. Always. My pleasure.